is really focused around the hours leading up to a patient's death, as well as the time of death and just after. If a family member is at the bedside, what you can do to provide comfort is to encourage those family members to use touch through the PPE if it's appropriate. So, giving them permission to hold the patient's hand, to rub the patient's feet or hand or arm. Invite the family member to talk to the patient, to reminisce, to share stories, to tell them how much they love them, how much, they're going to remember them, how they're going to be remembered. Invite them to sing, to read aloud, whatever feels right. That voice, familiarity is very powerful and comforting. And also, it's very important explaining what's happening and what to expect next. So many people have never been at the bedside of somebody who's actively dying, and the idea of that can be incredibly frightening. So the more information we can give them, as long as it's appropriate, they can better understand of it and make sense, and it's in theory less scary. But always check in, say, do you understand what's happening? Would you like me to give you more information? What do you understand is happening right now? Use those kinds of cues to figure out where to start and how far to go with it. When I talk about providing appropriate information to family members about what it is that they're seeing and hearing and experiencing, so that they understand the dying process and what might come next, in the context of COVID-19 with respiratory symptoms, I would imagine it's likely very important to educate families appropriately around some of the signs that they'll see around breathing. So talking about, that breathing patterns will change, that there might be cycles of breathing where breathing stops for what seems like a really long time and then it restarts again. Often this restarted breathing is very rapid and deep, and then it slows and stops again, and then the cycle repeats over and over. That can be particularly traumatic for family at the bedside watching that, because they think, they're watching and they think, oh, okay, he stopped breathing, he must be dead, and then it restarts. And to have that over and over and over, it kind of toys with your emotions. Letting them know that that's what it is, I think is a way for them to better prepare themselves for it and understand what's happening. You can also let them know that breathing can become quite noisy. Telling them, that during dying, swallowing becomes impaired, and secretions which we would normally be able to swallow and would, provoke a cough, it sits at the back of the throat. And that with each breath, air bubbles go through this fluid, and the resulting sort of guttural noise that comes from this, that can cause concern and distress for people that are hearing it, particularly if you don't know what it is. So explaining that to folks can be quite valuable. Warning families of these common changes, that they might witness can, help prepare them ahead of time and mitigate some of that trauma. One of the most difficult things that I think I've been involved in, not just during pandemic, but just in my work in hospice palliative care, end of life, bereavement, has been helping a loved one to say goodbye to a dying family member from a distance over the phone, when there's not enough time for them to get to the bedside, or they're restricted from being at the bedside. Providing an opportunity to say goodbye is incredibly powerful. I hope that I never forget how sacred that is, and how amazing it is that I can be part of such an intimate conversation to bear witness to that. There's been some incredibly beautiful things that I have seen by doing this. Remember the acronym of LOVE, LOVE. So L stands for lean into it. So this refers to, introducing yourself and giving some context for why you're calling. So you may say, my name's Natalie. I'm a social worker with the team. I've been involved in supporting your mom with care since she's been ill. What we know is that your mom has COVID. And I was just talking to the doctors, and I understand that her status is declining. O is offer up some of the things that matter the most to people. So for example, I may say, so we have the opportunity to make this time special. We don't have a lot of time, but we have this time to make it meaningful and special. For many people, there are 5 gifts that we can give them. The 5 things that you might want to say, whatever rings true to you, are please forgive me, I forgive you, thank you, I love you, and goodbye. And then check in and say, do any of those sound good? V refers to validating. So I've been part of these conversations and I found myself saying things like, I think that's a beautiful thing to say. If I was your mom and my daughter was saying that, I would feel so loved and valued. And then E is expect emotion. So, often people will struggle through those conversations and there'll be lots of tears and lots of pauses. Just allow for it. Just sit with that discomfort. So you're encouraging them, take one step at a time, say whatever it is that you need. Take your time. I'm here. The phone's by your mom's ear. Okay, just go ahead when you're ready. You can gently provide prompts and reassurance like, I can tell that your mom means so much to you. This is really hard. You're doing a great job. If I was her and I was listening to your words, I would feel so loved. At the end, because we've likely triggered a lot of strong emotions and feelings, I would really encourage you to say to the person on the line, can you stay on the line for a minute? I just want to check in and make sure that you're doing okay. And then you can, remove yourself from being by the patient directly, and then you can facilitate a conversation and a debriefing of sorts. So remember too that for patients and families who have practical concerns around things like finances, we know that unfortunately during this pandemic, people are getting laid off. There's lack of income. Bills still keep coming. So if you come across as a service provider in the community, folks that are struggling with financial strain is just one example, or housing, or getting access to food, and they need some guidance, some support, some advocacy, reach out to the social workers in the community. There's many of us that can guide those folks through. So consider making referral to the social work team through the patient's family health team, through the Lynn Home and Community Care, through your local hospice. With this respiratory distress, the agonal breathing and breathing changes and the sounds, the sights that family members are bearing witness to can be incredibly traumatic. I know that our teams are doing everything they can to manage pain and symptoms, but the reality is it may not look like the good death that we all envision. So in this context, it's important for you to be prepared to see acute traumatic grief. Common responses to trauma include, intense and unpredictable feelings. So they may have you may see a complete outburst of uncontrollable tearfulness, throwing themselves down on the floor, throwing a pillow, punching a wall. A common response is changes to thoughts and behavioral patterns. So somebody that maybe was really sort of anxious may, after the death, all of a sudden just go completely numb and completely calm and just have a flat affect. Or vice versa, somebody that had been very calm and stoic, at the time of death, all of a sudden is raging, out of control, becomes sort of manic. And also changes to thought patterns. So you may even notice that somebody you're explaining what's going on, what has just happened, what you'd like them to do next, and it's just blank. Like they just can't retain the information. They're not able to concentrate and focus on what you're saying. The inability to retain information, that they need constant repetition. So a response to traumatic grief is a sensitivity to environmental factors and hypervigilance. So you may see that in folks that become easily startled. You know, they may be sitting on the couch trying to sort of process what's just happened, and you walk up behind them and you gently touch their shoulder and they jump. So that's a common response to trauma. You may also see some strained interpersonal relationships. You may see some disagreements between the two, or some change in dynamics, or maybe even with you as the service provider and the family member. They may direct their blame to you, their anger toward you. That can all be part of a traumatic response. You may also see some stress-related symptoms. So a family member may suddenly start to say that they're having some chest pain, or they have some shortness of breath. They may have an increase or a decrease in their blood pressure. They may become very shaky. They may demonstrate some of those like traditional shock symptoms. So some dizziness, some sweating, maybe increased heart rate, sometimes even nausea and vomiting, depending on how traumatic it is and how that person is processing it. That paralysis of emotion and numbness, excessive tearfulness. Those are all things that you might see. Some of the things that you can do to support a family member that is experiencing acute, intense grief after your patient dies is to just provide them with comfort through touch if it's appropriate and safe. Again, allow for silence, right? We can't, remember, you can't fix this for them. Their grief is reasonable and expected, and in actuality, it's therapeutic. That's what will get them to a place of healing, is first being able to feel it. So allow for them to do that. Give them space to do that, and just be present. It's that simple. When you're going through something like that, you just don't want people to abandon you. You're in the depths of despair. You're feeling lost and broken and vulnerable. And there is such value and comfort that comes from knowing that there's somebody that can handle it. There's somebody that can bear witness to it. They're not scared and they're not going to leave. That's a very important message. The most important thing is that you acknowledge the experience, you identify the feeling that you're seeing, that you validate it, you normalize it, and then you provide support. Even little gestures like offering comfort care. So, offering them a glass of water, getting them some Kleenex, helping them to sit down in a chair, maybe even help them to lie down if they're feeling sort of lightheaded or completely overwhelmed, providing them with a warm blanket. Any of those small comforts can really help. Many of us have been at the bedside of those that are dying and have witnessed the moment of death many times in our professional world and in our personal world. It never gets any easier though. It's still an incredibly sacred space. In reality, I hope that I never go numb to that. I think it's such a privilege to be part of those experiences and be part of somebody's story and journey. You've been doing amazing work for many, many years, and I know this feels different and it feels overwhelming at times, but I think we just need to go back to basics. I think we just need to remember, we are human beings, and this is just about a human-to-human connection, and at our core, what is it that we need? We need compassion, we need respect, we need dignity, we need presence, and we need time. And those are the things that we can give folks. We can give of ourselves.